Thank you, Margie. A cyber criminal ransomware attack last week shut down emergency rooms in multiple states and caused ambulances to be redirected. Blade Technology Scott Schaefer joins us, and this was Prospect Medical Holdings.
That's right.
Good morning to you.
Good morning to you. Yeah, Prospect Medical Holdings, they have holdings in 5 different states. And the breach or data incident occurred basically across their entire wide area network.
Did not affect Missouri or Illinois, but it is a wake-up call for us.
Yeah, it is, because it's a critical infrastructure attack. And usually when we think of critical infrastructure, we're thinking about power stations, water, these sort of things. But healthcare is really the most important one of all if you look at how much they're exposed and how much money the healthcare industry pays a year to remediate and to pay ransoms. And
it's expensive.
Absolutely. It's number one, because you look at that sector, they're doing $1 million a year, basically an average. Every breach, $1 million or $11 million bucks, pardon me. But health in financial, you only see it worth about maybe $5,000 per incident. So it's a big different change between them, because there's all that critical health information that people can take and just manipulate, combine it with other information they have somewhere else, conduct social engineering attacks against people like phishing, targeted stuff, because they'll have some information that makes it seem like they know what they're talking about, that you have Crohn's disease or something like this, and then they can market directly to you and then rip you off.
Well, you can't really control it. Like,
No.
For example, I went in for an MRI a couple weeks ago, and they asked one on the sheet for my Social Security number. I didn't put it down.
Sure.
Because you don't know who's going to get that.
Absolutely, especially if you're putting it on a piece of paper.
Right.
Because a lot of times paper gets away from you a little bit easier than electronic data. But yeah, that's the thing. As a consumer, what you need to do is just be aware if any institution or company you work with that has a data breach of any sort, generally they'll always have something on their website saying, here's what happened, here's what your exposure, and then they'll generally, if there is a problem, they'll give you like 1 year credit monitoring or something like that.
Well, how will it affect you though, really?
Really? It could line you up to be attacked by some online scammers, with the healthcare stuff. That, and they're ransomwaring the data, so they have to pay money to get the data back, the medical facilities do. So that's one thing you just have to look out for. It won't be the actual breach that gets you, it's what they do with that information down the road.
So we have the healthcare industry, number one for hackers.
Yep.
Number two, I'm guessing financial?
Financial, yeah, but only about half of per incident than healthcare. And it's kind of interesting that you see, even though healthcare has less money running through it, you'd think, financial industry, their incidents are, like $5 million bucks per incident, compared to 11 for medical facilities.
And when this happens, it takes several weeks, even longer. I know when it happened in St. Clair County, they hit the local government. It was shut down for quite some time.
Absolutely, and with healthcare too, sometimes we overlook. I mean, people could die. You could have somebody have a problem. It's not like a financial institution. You lose some money. Really, who cares? But if somebody dies, that's a big thing. So that's what they have to watch out for.
Well, would you tell, as far as the healthcare industry, be prepared, have paper?
That
get the old typewriters out. Really,
they have to have a good plan, and that really goes not just for healthcare, but any organization needs to have a plan. Because it's going to happen, more than likely. Maybe it won't be a big breach, but something's going to happen. You need to have a plan on what to do to find out what happened first and how to remediate it so it doesn't happen again.
All right, that does. Scott, thanks so much.
Pleasure.
Now, Scott's got to leave, and he has to have a plan. Is there a traffic jam?
Oh, I don't know. Is there?
Let's find out from Amelia.